Hey, what's up, everybody? Thank y'all so much for coming back to On the Move PT and Wellness, the new YouTube channel. My name is Travis Hauser. I am the owner and the physical therapist of On the Move Physical Therapy and Wellness, where it's my job and it's my passion to help those active aging adults to get a level of physical freedom so that they're able to enjoy their life and enjoy their retirement to its fullest without having to settle for less. So, if you've been here the past couple of Mondays, this is transitioned over from Facebook now to YouTube so that you can find the videos easier. And so it's a weekly segment, and I call it On the Move Monday. So for my old On the Move Monday watchers, thank y'all for hopping on YouTube and checking out the video. And for anybody that's new, welcome. Welcome to the On the Move PT and Wellness YouTube page. So for those of you who don't know, this page is going to be dedicated to every Monday, On the Move Monday, where I offer tips and tricks for different sorts of pains and aches. And I like to try to explain things and really just try to teach people about physical therapy and what I do. Last week, I kind of went through the exact program that I go through with all of my clients, where I call it Move. So if you missed that video last week, go check it out and let me know what you think. This week, I'm going to go into back pain. So back pain is such a hot topic in the world, not even just in the physical therapy world, but in the world. And so I have a couple of statistics that I want to talk about first. So something like 31 million Americans at any given time, estimated, has back pain. And that's a huge number. To think that 31 million Americans at any given time, it's estimated that number of people have back pain at any given time. That's huge. Now, back pain is also the most common ailment for people to be on disability or to miss work. Back pain is also one of the top reasons that people visit the doctor, only second to upper respiratory infections. So we know here in 2021, upper respiratory infections are up there, but back pain still remains in second of the reasons that people go to the doctor. One half of working Americans, it's estimated that one half of working Americans are going to have back pain at some time in their working career. One half, that's also a really huge number. And so if you think about that, 1 out of 2 working Americans. So if you're sitting next to somebody who's a working American and neither one of you had back pain yet, one of you two is going to have back pain. And that's something that can be avoided, but sometimes it just comes around. It's important to know what to do to prevent it, and it's important to know what to do to treat it. And so those are some things that I'm going to go into in the next couple of weeks. But today, I just want to talk about back pain for a little bit. Another interesting thing is that Americans spend at least $50 billion in healthcare costs on low back pain. And that's just for the things that are easy to count. So that might be doctor's visits or therapy or MRIs or x-rays or any other sort of easily counted healthcare costs. $50 billion is spent on low back pain. So my question for you guys is, have you ever had low back pain? You can let me know. I'm still new to this YouTube thing, and I'm going to try to figure out these comments. But if the comments are turned on, let me know if you have experienced low back pain, and let me know what you did for it. So low back pain kind of comes in a variety of different categories. So one of the most common categories, you'll hear people talk about, my back went out, or I had a catch in my back and I can't get it to release. Those types of low back pain are most commonly caused by muscle. And so there's kind of a misconception in the medical world, right? So if you have low back pain and you go to your doctor, probably one of the first things with a lot of doctors, one of the first things that they want to do is they want to order an x-ray and then potentially order an MRI. But more than likely, that x-ray is going to show the catch-all term of arthritis, especially if you're over the age of 50. But I've had people who were 35 and say that their doctor told them that they had arthritis. And so all arthritis is degenerative changes that happen as we age. And so those aren't normal under perfectly ideal circumstances where you're doing all the things to support your back, to keep it strong, to keep it flexible. You're less likely to have these degenerative changes, but in real life, you may sit for work. That is terrible, and that will degenerate your back quicker. Or you may drive a lot for work, which also falls under sitting. Or you may be really hard on your back. You may be lifting, whether that be for work or whether that be for exercise or for whatever that might be. Lifting without proper form and proper strength, that can speed up those degenerative changes as well. Now, I'm going to stop for a second and talk about degenerative changes. They've done a ton of research on low back pain or lack thereof and MRI studies. So they took a group of Americans who did not have low back pain, and they did an MRI on all of them. And something like 70% of people over the age of, I think it was either 50 or 60, but 70% of those people showed bulging discs. They showed degenerative disc disease, or all those common things that you may hear, or stenosis. But remember, they didn't have pain. So that kind of tells us that it's not always these arthritis or degenerative disc disease or stenosis. It's not always those diagnoses that cause the pain directly in the back. As a matter of fact, those changes may create change in the muscle, and they may make them tighter. And so typically, especially with the people that I see with low back pain, they're the ones who have really tight muscles, and by loosening them up and strengthening the muscles around it, their pain typically does decrease significantly. And so if you've heard those terms, arthritis or degenerative discs or bulging discs or herniated discs, if you've heard those terms, I suggest that you get a second opinion, potentially by a physical therapist or a chiropractor or some other healthcare professional, other than somebody who told you that based on an imaging study, so an x-ray or an MRI. Because if they didn't do a full physical exam and watched how you moved or watched how you lifted, if they didn't do any of those things, there's a chance that it's not even those bulging discs that's causing the pain. As a matter of fact, bulging discs have minimal nerve endings in them, and so oftentimes those aren't the source of the back pain itself. Now, we'll go into the next category of back pain, and I'll call that back pain with leg pain. And so that might be on one side or the other. But if it's on one side and you have a diagnosis of a bulging disc, there's a chance that that bulging disc is pushing on the nerve. And so that nerve goes down your leg, and you'll hear that common term sciatica or just back pain with leg pain. And those are, you treat those differently than you would with somebody with just low back pain, because we have to figure out how to take the pressure off of the nerve. Sometimes that can be done with anti-inflammatory, so it just reduces the size of the nerve. And sometimes that needs to be done with some sort of traction or stretching the spine to help those discs go back where they need to go. And the last resort is typically surgery. So if you have had low back pain and you've seen somebody and they've told you, well, you need surgery, but they didn't recommend any sort of therapy or exercises, I challenge you to reach out. You can reach out to me or reach out to your local physical therapy office and find out exactly what might be causing the back pain. Surgery might be what needs to happen, but have somebody check it out, because if it's something that can be treated easier than surgery, it's definitely worth it, because the downtime after surgery is huge. It puts you out from work, it puts you out from spending time with your kids or your grandkids, or working in your garden or playing golf. It takes you out of all of those things for, 6 months is a minimum. Usually a year or so is how long it takes you out. And I've seen it take people out of those activities for good. And that breaks my heart. So if you, like I said, if you've been experiencing any back pain, reach out to somebody, and don't just sit there and think, oh, well, I'm getting older, so my back is probably gonna hurt. If you reach out to somebody and they try things and it doesn't help, then that might be the case. But 9 times out of 10, something can be done to reduce that low back pain. And so next week, I'm gonna go into a couple of different exercises that I give to all of my low back pain clients. Well, let me not say all of them, but most of them. I always come up with a super individualized plan for each of my clients, but these are some foundational exercises that can really help to strengthen the back, strengthen the hips, and stretch the hips and stretch the back. Next week, I'll talk about why that's super important to do, because it is all connected. So if you have any questions, please feel free. You can reach out to me on Facebook, Travis Hauser, or you can reach out on my Facebook page for On the Move Physical Therapy and Wellness. If you type that in the search, you can find that and send me a message there. Or you can find me at On the Move ptandwellness.org, and you can reach out to me that way. If the comments do get enabled, you can leave comments, and I will monitor those, and I will also answer questions that you have there. My biggest advice is, like I said, if you're having back pain, please reach out to somebody, because it doesn't always have to be there. There are many things that can be done, and there are many things that can prevent it from coming back. And so if you're one of those people that has back pain and it comes back once a year, try to find something that you can do to prevent that from coming back and keeping you out of work and keeping you from living the life that you want to live. So guys, until next Monday, keep on moving. Have a great one.